By 2020, 65,248 people were living with cancer. 3,418 cases were reported and 22,992 deaths were reported. Today we are at the Uganda Cancer Institute and we are going to focus our attention on breast cancer. A good evening to you. You are welcome to the Health Code. I'm your host, Hope Nyongereza. Majority of the women in Uganda suffer from, are diagnosed with stage 3 and stage 4 cancer, and today we are going to see why this is the case and why this frequently happens to women, especially in Uganda. With us we have Dr. Alfred Jatho, the head of training and the community center head, who's going to give us more information regarding breast cancer.
Good evening, Hope. Nice to be with you. I'm Dr. Alfred Jatho. I work at Uganda Cancer Institute. I head the training unit. I'm also a community cancer health educator at Uganda Cancer Institute, yes.
Thank you so much, Doctor.
You're welcome.
So to begin with, how many patients do you receive annually at the Cancer Institute? Okay,
when you look at Uganda Cancer Institute alone, the average patient load currently is at 7,000 patients. But the total person expected to be living with the cancer per year is average of 32,000. And the number of cancer patients expected during a 5 years time in Uganda is 62,000 people. That's the one we have just stated now. So the data that estimate the annual number of persons expected to be living with the cancer and the 5 years time is the data reported by the International Agency for Research on Cancer, which at times also called GlobalCan. GlobalCan just means global cancer data. That data is usually derived from our population-based cancer registries, the two main ones currently, the Kampala Cancer Registry and the Gulu Cancer Registry. As of now, there are other cancer registries in Uganda that we know soon will be adding more data in estimating the cancer burden in Uganda. Mbarara, Mayuge, Mbali, Arua, Gulu, Rwenzori, and Shigezi.
Okay, Doctor.
Yes, please.
What are the risk factors for cancer, especially among women?
For cancer in general or for breast cancer?
For breast cancer.
Yeah, when you look at breast cancer, it is difficult to pinpoint one factor to be causing it by the number of factors. So those factors, precisely, we can put them in two broad categories, what we call modifiable factors and non-modifiable. The non-modifiable are the ones that we may not do much to change them. They include genetic makeup. Some individuals are born with some genes where if those genes get mutated, they get some damage, they can increase the risk of developing breast cancer. The two common genes include what we call BRCA1 gene and BRCA2 gene. When they get mutated, they increase the risk for breast cancer. And also, the age of the person. Like in other cancer diseases, many of the cancers tend to occur in older persons. So as someone becomes older, the risk for developing cancer increases, which is also true for breast cancer. That one doesn't mean that younger persons do not develop breast cancer. We are seeing breast cancer even among younger women, but it's more common among older women. At the same time, in terms of non-modifiable factors, we have seen that the height, the adult attained height, people who are taller tend to have increased risk for breast cancer than those people with the reduced height. So the number of mechanisms that explain that, but for the purpose of the community out there, the public, you should just know that the thing that we don't have control over, like our age, the genetic makeup, and maybe the adult attained height can increase the risk for breast cancer. And then the other thing that can increase the risk for breast cancer fall in the category which we call modifiable. Modifiable means we can change them. You can do something as an individual to change them or to avoid them, or you can do something as a community or as a country to reduce exposure to those things that can increase the risk for developing breast cancer. So there's so many studies reporting risk factors, but there are those ones which we classify as having strong evidence, meaning that it has been proven beyond reasonable doubt that they can increase the risk of breast cancer. One is pregnancy. Okay, so women who wait and maybe begin having their first pregnancy after the age of 30, they have increased risk of developing breast cancer. This also relates to breastfeeding. Women who give birth and do not breastfeed their children, they have also increased risk of developing breast cancer. This is normally related, the mechanism involved here is to do with hormones. You see, when you become pregnant, certain hormones are responsible for maintaining that pregnancy. And then certain hormones are put down, are secreted in smaller amount, to use simple words. So that one gives a resting time for the body. But even breastfeeding also has influence on the hormones. So when you look at it, it gives, during the course of lifetime of the person, it gives some protection from certain type of hormones, which when in a higher amount all the time over many years, increases the risk for developing breast cancer, particularly a type of breast cancer called hormone-dependent breast cancer. Yeah. Then other risk factors are physical inability, or what we can call physical inactivity. Okay, let's put it as physical inactivity. This means if you're not physically active, you're not engaged in walking, running, doing some domestic chores, all the time you live sedentary lifestyle, sitting lifestyle, you work your body less. So the risk for developing breast cancer increases. Yeah. So we advise our people to keep physically active. You may be doing some office work, but at least get some time where you can do some walking. When you're at home, do some domestic chores. The guideline normally say at least use at least 30 minutes per day where you're physically active. Doing you may be walking, and not just walking slowly, what they call brisk walking. You try to walk with energy faster, so that by the time you end your 30 minutes walk, probably you are sweating. Or you can do running, you can do domestic chores, you can do gardening, if you have some garden behind your home. If you're in an office, you can, during lunch, you can take a walk where the restaurant is. You don't need every time to drive yourself or use a boda and so on. So that one can keep you active, yeah, to reduce the risk of developing breast cancer and other types of cancer. Also the mechanism. Physical activity helps a lot in the general health of the body, and also help to balance so many types of hormones in our body, because our cancer can also be hormone related, particularly breast cancer. The real group, a huge group of category of breast cancer, which are classified as hormone dependent. But exercise or physical activity is very important in balancing the level of this hormone in the body, so that in a normal level that our body needs for normal health. Yeah. And then other things that we can do something about or avoid is the weight. The weight. So if the body fatness, maybe to summarize it can be either body fatness as it is, or the overall weight of the person. So people who are overweight, or the worst form of overweight, which you call obesity, those who are obese, they have higher risk of developing breast cancer. So to avoid or to reduce the risk of breast cancer, keeping our weight in the healthy band is recommended. Many people out there may not know what is the healthy weight range. You can always get advice from your health worker. You take your measurement, your body weight in kilogram, and then they measure your height. You divide this the weight you have in kilogram over the square of your height in meter. It gives a measurement called body mass index. So generally, body mass index between 18.5 to 29.5 is regarded to be healthy. So something like 30 and above is already overweight. And when it goes more, 35, 40, and so on, that's now obesity. But again, underweight again is also not healthy for someone. But here the major thing to keep within the range of the healthy weight. Yeah, that can be good for our body. This is something you can do. You see, weight is, some people can say, I'm naturally born heavier, oh, I have more weight. That is true. But you can do something about it in terms of managing through physical activity. You can keep your form in good shape if you can engage in physical activity. Then other thing that we can do something about is the food we eat, diet. So if you eat less variety of food and you eat less fruits and vegetables, your body like to get less nutrients that are required to protect your body. So we advise people to eat a variety of food, especially our local food here. And then at least try, whether it is difficult, try to make sure each day you have some serving of fruits and vegetables in your diet. That will help to reduce the risk of breast cancer and other types of cancer.
So how can we prevent ourselves from falling prey to this?
Yes, Hope. Yeah, thank you. That's a very good question. Yeah, generally, what is classified as organic is the best, is what our body needs. When you go in the market, you go even to Europe, there are food which are classified as organic. That is purely, that means produced free from those other harmful chemicals, okay? That should be the best. But we also live in an environment where you may not only have only organic food. There's what we call necessary evil, whereby there's a modern way of producing, the population is growing. You have too many people that need food. So you may need to use these fertilizers, okay, to make sure these food are grown well and not destroyed by the pest. But also, some of them help to make sure the crops or the animals grow faster, just to try to meet the demand that we have in the world. But where you can manage, I think organic food is encouraged. Where you cannot, then of course you need to eat something for survival. Yeah, that's my position on chemical and so on. But of course those chemicals, there are those ones which are known to be safe to human consumption, not to be consumed of course, but safe when applied safely to the crops, okay, by the qualified person. And these chemicals that enter the country should meet certain minimum safety requirements. But when the wrong type are used, then you're like to get problem. But when the right type is used in the right amount, you are likely to avoid the bad problem. But overall, my position is what is organic is better than what is not organic.